Health trainers and health champions work with communities that are disadvantaged, maybe high unemployment, there may be poor housing, all sorts of things that get in the way of people exercising their choice to live a healthy life. And they're part of a bigger strategy, the Healthy Communities Programme, which works alongside people with community groups and organisations that have that very general aim to improve the quality of life for people in those communities.
Well, I think you could describe the FIT in two ways. As the practical way we deliver it, which is unique, I think, to Sheffield and the NHS in Sheffield. And also it fits in terms of what it achieves on behalf of the NHS. So in the first instance, I think we have a really good setup really in Sheffield, because we've got the Community Development and Health Programme, and a lot of our communities that have got a lot of pressures on their health, and there are big inequalities across the areas, do that course. And that's quite transforming in the first instance. A lot of them go on to get jobs and volunteer and other training. And then from that, we have a Health Champions programme where they can volunteer. And from those health champions, we've been able to recruit our health trainers. Now, all of that sits within our Healthy Communities programme, whether that's physical activity or healthy eating or environment projects or supporting people in terms of Citizens Advice Bureau work or Affordable Warmth, for example. And that is provided by the voluntary sector in Sheffield, which gives us that unique approach with all the contacts. They've got a structure there that people can volunteer into and can be supported into. But it's also a structure which got that incredible network within the community where we can reach the most vulnerable person, or the person who's not really just going to turn up at the doctor's when they might develop a symptom, but they might take notice of a friend saying, oh, why don't you go along to this course, or why don't you go and have an appointment with the health trainer, because that made a real difference to me. So that's the model we've got. And I think if you took one of those initiatives out of the Healthy Communities programme, I think they would find it difficult to achieve in the same way, because we've got that community connection. And I think our reputation as it's grown goes before us. So we have a waiting list for some of the things that we're doing. And we really make a huge difference, I think, if you hear some of the stories about how people have transformed their lives as a result of having that health trainer or health champion support.